Hi guys, it's Morgan, and I am here to talk about biotechnology within cancer treatments. So at first, we need to talk about like the normal cancer treatments. The first one's chemotherapy. What they do is they use strong chemicals and inject them in the body, and then those chemicals will basically destroy every cell within like the cancer area that they injected. The only problem is that it doesn't stop when it gets to like the cancerous section. It destroys like every cell within it. The side effects are pretty bad. Like the normal ones are like nausea, vomiting, diarrhea. Most common is hair loss and fatigue. But the long lasting and late developing ones are like damage to lung tissues, heart problems, infertility, kidney problems, nerve damage, and risk of getting cancer again because of how weak your immune system is based off the fact that you don't have any more cells. I know that's not how it goes, but it's how it's going to go. The second type is radiation therapy. Radiation therapy targets a certain area where they use beams of intense energy to shrink and kill them. The side effects are based off where in the body radiation was used. In any part, it's hair loss, skin irritation, and fatigue. If you have it around your head and neck, it's dry mouth, thickened saliva, difficulty swallowing, sore throat, changes in the way food tastes, nausea. Chest is difficulty swallowing, cough, and shortness of breath. Abdomen is nausea, vomiting, and diarrhea. In the pelvis, you have diarrhea, bladder irritation, frequent urination, and sexual dysfunction. And I know you're wondering, why would someone ever want to go through this? And honestly, I don't know. But luckily, in 1983, monoclonal antibodies were like used at first to help patients with non-Hodgkin's lymphoma. In Berlin, there was a like a treatment going around. It's called Herceptin. During the trial, people were going into 93% remission. This was used by the biomarker HER2, which is the most common oncogene. This one originally only targets one single cancer cell so that it doesn't target everything around it. But the only problem is that when like one cancer gene is prohibited, there's another outlet basically to go to it. So that is where the creation of biospecific antibodies, which is most common known as immuno-oncology. And the best way I could describe this is it uses drugs to target your body's immune system. So basically it allows you to, your immune system to know what's going on and then help fight the cancer. The best metaphor that I found on the internet was actually about like a flower. And so like a normal flower is like a normal person. And then like the dandelions, the worst ones of all, are the cancer genes. And so once you have one dandelion, a million other come up. And the immuno-oncology is actually the fertilizer. So it helps you get your immune system back on track and help target the right cell basically, and this is used within chemo as well. Cell therapy is another amazing discovery. What they do is they collect immune cells from within your body. Once they go through a system of being replicated and taken out, the T cell, they're put back within it. And Robert Good was actually the first person to basically father cell therapy. He used this by doing a bone marrow transplant. So basically they took out the bone marrow and allowed the cell, like the blood count, to be replicated and then enter into the body to help protect it. CAR T is basically the baby of it all. It's a combination between cell therapy, gene therapy, and immunotherapy. This allows the bad side of everything I just talked about to get better. Clinical trials have shown remission rates up to 94%. The only problem is that it's so new that a couple of the trials have had a bunch of people die. But recently, there's a tech group called Selectus that is actually doing research with the Mayo Clinic and Johns Hopkins to have a better outcome. And so hopefully they said by 2020, but I think with COVID and stuff, things have been pushed back. The image that I have is basically just a diagram of how it enters in and what CAR T is. And there's my reference page.